Hey guys, so in the year or so since I posted my recovery videos for my ACDF, I've had a lot of people ask me questions, and although I've replied to everybody individually, I thought it might be helpful for me to make another video where I answer some of these questions because if one person had the question, then chances are someone else has the same question, and so I thought I would take this opportunity to share a little bit more about some of the details of my ACDF recovery. So one of the most common questions I've gotten is how long did it take for me to feel quote unquote normal after my surgery? So there's a couple different ways I could answer that. I would say that within 6 to 8 weeks, I definitely felt better, a lot better, a lot less of that feeling like I had just been operated on. As anyone who's had this surgery will tell you, it's a somewhat major operation. You are out for a few hours. For me, they had me spend the night in the ICU. I know that that's not everybody's experience with the surgery, but it was for me. So I was, hooked up to all kinds of monitors and things were beeping, and I had a nurse take my temperature every couple of hours. I mean, that is a traumatic experience. You're pumped full of a lot of drugs. So that kind of acute just been operated on feeling, that lasts a little while, a week or so, where I was just really kind of tired and lethargic, and I really wasn't in any pain. I never had any real pain after my surgery. My throat was sore, but it was just a classic sore throat feeling. It felt exactly like strep throat, no different. And once that feeling of, surgery had passed, it was a good month or so before I didn't feel quite so vulnerable. I was able to start to move my head around a little bit. So I would say that within 2 months, I felt pretty normal. I felt like I could, really function again in the world. But I still had some stiffness in my neck, and the scar was really pretty fresh, and I would say that at about the 4 month mark, 5 months. So for me, around Christmas time, my surgery was in the end of July. So around Christmas time, I felt good. I didn't feel like I had just had surgery. I was doing the bone stimulator still at that point, but other than that, that was the only real indication that I had had the surgery, besides, of course, feeling better in my arm and feeling like the herniated disc had been sorted out. But I was back to sleeping in my bed by then. I was able to drive my car by then. I could look around. I could, when I was in the shower, I could really tilt my head back to rinse shampoo out of my hair, where in the beginning, you're very kind of careful how you're moving. That passes pretty quickly. So within 5 or 6 months, pretty normal. It's been a year now, over a year. It's been over 13 months now, and I feel completely back to normal. I don't have any sense that I had had this surgery. So that is probably the best way. It comes in waves. It's the acute initial phase lasts 2 or 3 weeks. I will start feeling a lot more normal within 3 or 4 months, and like almost completely normal by 5 or 6 months. Another question I'm asked a lot is if I'm still feeling the numbness in my fingers. For me, the decision to have surgery was because the herniated disc was putting pressure on the nerve that ran down this arm and into the fingers, and my arm was weak and my fingers were numb. And the surgeon told me that he expected that I would wake up in the recovery room and all the feeling had returned to my fingers. Well, that was not true. I was numb. I've been numb ever since. I'm much less numb now, whereas before it was these fingers, and it was all the way, both of these fingers completely were numb. Now the numbness is really just on the inside plane of these fingers here. Here more so than here. And, still numb. The surgeon told me a couple of weeks ago when I had my 1-year checkup that I might be stuck with that numbness from now on. That would suck, but I'm kind of used to it now, and it's not so bad. It's definitely gotten better. I've been doing acupuncture, and when they've put the acupuncture needles in this arm for this numbness, and you kind of wiggle your fingers, I can feel a rush of sensation coming back into these fingers. So that suggests to me that those nerves are not dead. It might get better still. I've heard anywhere from, 12 to 18 to 24 months it can take for that nerve damage to repair. If it never got any better than this, I could live with that. Hopefully it will get a lot better, but, if it is even getting better, it's getting better so slowly and subtly that I'm not really noticing it. But it's definitely better than it was immediately after surgery. But for me, in my case, I think I let that herniated disc sit on that nerve just long enough. And perhaps if I'd had the surgery a few months earlier than I did, that wouldn't be the case. But, I was trying not to have the surgery and doing physical therapy and all of those things. And in the end, it is what it is. I've been asked if I still notice the same range of motion in my neck after surgery, after the fusion, and yes, completely. I do not notice that I can't turn my neck, it's the same. I can do all the things that I could do before surgery. I do feel a little bit of muscle tightness, especially over in this direction. And that, I think, is just sort of par for the course with this surgery. As I was recovering in the early days, the thing that I noticed that would bother me the most is the muscles in my kind of shoulders and upper back. And, I think that's just what happens when you take that level away, when you fuse a level. All those little muscles that feed into that level on your spine, you put them out of business. They don't have a job to do anymore. And it takes them a little while to kind of figure out what to do. So I definitely experienced a lot of soft tissue tenderness and soreness. I did a lot of soft tissue massage, deep tissue massage, and that helped a lot. That was, painful. It's somebody, digging their elbow into a sore muscle and leaning in for a while. But gradually, it hurt less and less. I was able to kind of sleep better, be a little looser, be a little easier to move my head around. But the range of motion, once all of that muscle stuff got taken care of, the range of motion, I don't notice any difference. So physical therapy is something that not every doctor will prescribe. My doctor didn't really seem to care much about physical therapy. I asked for physical therapy, and he was like, all right, whatever. He didn't really think it was that important. I think a lot of surgeons think if you're going to recover from the surgery I did because I did the surgery on you well, so you're going to recover physical therapy or not. And I get what he's saying, but I wanted to do some physical therapy. Unfortunately for me, I had actually used all of my physical therapy benefit up on my insurance before my surgery because I had been doing physical therapy in an attempt not to have the surgery. So by the time I actually had the surgery, my insurance was not covering physical therapy anymore. So I went in and did a couple of sessions out of pocket, and that was mostly about getting a home routine down, stretches and exercises that I could do at home. And, I don't know how helpful it was. To be honest, I wasn't super, super diligent with the physical therapy. I was feeling pretty good pretty quickly. And, for me, I feel like I would be where I am today in terms of my recovery, regardless of whether or not I did physical therapy. I think it's important to, kind of gradually get that stretch and movement back in. Like I said, I did massage, and that was really helpful for me. I also did ART, which is active release technique, a kind of a massage, very intense, soft tissue, pretty painful, but it was very helpful for me. But, once you have this surgery and you are surgically fused, I do believe that you're going to recover from that. That's why you had surgery. And physical therapy will help, and it can help you make things stronger. But I don't think that it is the key ingredient to your recovery. So for me, I did a little bit of physical therapy for a month or two, and then kind of let it taper off and relied on massage for my recovery. So this is an interesting question I've gotten a couple of times, and I've also been asked this a lot by my friends and family, and that was whether I chose to use a cadaver bone or use the lab synthesized bone. And I chose a cadaver bone. The way that it was described to me was that you had a better chance of fusion with the cadaver bone because it is natural bone and your body will recognize it, and there's less of a chance for rejection. And it's organic and they kind of know what it is, whereas some of the lab synthesized stuff, there wasn't a lot of long-term studies about how it was going to age in your body. And that was all I needed. I was fine with using the cadaver bone, and I kind of looked at it as the miracle of modern medicine, that we've figured out how to use our bodies to heal our bodies. And if anything, it made me feel more determined to be a donor, to kind of give back a little bit. I really never think about it. And there's been no issue. It's fused well. So for me, it was the best case scenario, and I had no problem using a cadaver bone. So, like most people, I have a titanium plate that they installed after the surgery to keep my head on. And it is still there, even though it no longer serves a practical function because the bone has now fused. And it's fine. I've never had a problem with it. In the beginning, the first couple of months, I guess everything was still swollen. And I found that if I was like leaned over, like if I was playing with my dog on the ground and my head was sort of down low and I was talking, I could feel something on my throat, like almost like having something stuck in my throat. It didn't make me feel like I couldn't breathe. It didn't make me feel like I couldn't swallow. It didn't feel like a threat or a danger, but I had a sensation in my throat. Or if I sang, I would notice it. Now, a year later, I almost never feel it. Occasionally, again, if I'm kind of bending down and picking something up and talking, I can feel a little something. But it's never been a problem. I've flown many times since I've had this surgery. It's never set off any metal detectors. It's not really a problem, and it's going to be in there for the rest of my life, and, it's fine. So one of the things I've been asked about is the bone stimulator. I know not everybody does the bone stimulator. My doctor had me do it. It didn't cost me anything. My insurance covered it. I used it for about 6 months, every day, at the same time of day. And when I had a checkup several months after my surgery, my doctor told me use it until it stops working. I guess at a certain point, those bone stimulators just don't work anymore. And he said that's around 9 months. And, to be honest, I used mine till about 7.5 months. And then I had to travel abroad. and I was gone for a couple of weeks, and I knew I couldn't take it with me because you needed to use it at the exact same time of day, and that was going to mean something like I was going to have to use it at like 3:30 in the morning or something while I was traveling, and that was not going to happen. And I was also so far down my road of recovery that by that point that I just stopped using it, and I never used it again. I really couldn't say if it made any difference. I mean, I fused, and I fused at about a year, or at least I was fused when I had an x-ray a year after surgery. So I guess it worked. It didn't hurt. It was kind of a pain, You really had to restructure your life around sitting down and having this thing on your neck for a half an hour every night. And it's tricky on the neck because you can't really do anything else. If it were on your hip, you could kind of, put it in a harness and or like a belt buckle or something and like wrap it around you and go into the kitchen and make dinner or whatever. But when it's on your neck, there's nothing you can do. You got to just sit there with it. And, I really couldn't say. I would say that if you have the opportunity to use it and your insurance covers it, go for it, right? Anything helps. Any extra help you get is a good thing. But I'm sure that plenty of people have recovered very successfully from this operation without using a bone stimulator. So, again, it's one of those things like physical therapy. You're going to heal one way or another. And anything you want to do to help yourself along is great, but I don't think any one component is as important as just time and a little bit of patience. So those were the main questions that I've gotten over and over again. Again, I think I need to just give this little disclaimer that, of course, I'm not a doctor. Some people asked me, my MRI showed this. Do you think I need to have surgery? Couldn't begin to answer those kinds of questions for you. If you have any questions like that, obviously your doctor or, one of several doctors that you try out are the people to ask those kinds of questions. But all in all, I can say that my surgery, although terribly frightening at the time, and I was so not looking forward to it, and I was really freaked out about it, really turned out to be a shorter and less unpleasant chapter in my life than I thought it was going to be. And I almost never think about it now. A year later, it is just not a part of my life anymore. I still have the scar. I'm cool with that. And, may everyone out there who is having this surgery or thinking about this surgery or just had it, just know that, they can do really amazing things now. And, if you're comfortable with your doctor and you do what he says or she says, then you're going to recover beautifully from this. And I'm here for you. If you have any other questions, please don't hesitate to contact me, and I promise I'll get back to you. Thanks a lot, everybody. Happy healing.